Hello, my name is Kate, and today I will be producing my findings on Topic 2, a lack of clinical decision support and professional development for rural healthcare providers. According to the 2011 census, 11% of Australia's population lives in a rural or remote area, with that adding up to be over 2.2 million people living outside of a major city or in a regional town. The isolation makes a difficult job for healthcare providers to have the necessary support that they need to give adequate primary and follow-up care to their patients. The major issue regarding a lack of professional development in rural areas for clinical providers may be due to the remoteness of the location, the difficulty to find funding for refurbishments and further training, and availability. Rural health relies heavily on the community bonds to keep the healthcare in check. Doctors, nurses and paramedics knit closely with the remainder of the community to increase the level of satisfaction for patients and to notice health trends in the wider community. Some of the causes of lack of clinical decision in a remote location may be due to the location. As people who live in a remote setting cannot travel long distances to major cities to see specialists, projects could be brought in to allow patients to receive more care at home. Funding. With a lack of income for rural healthcare, funding is often required to support training for healthcare professionals and upgrades to the facilities to ensure the best possible care. Availability. There is a shortage of all healthcare professionals in rural Australia, and because of this, the carers that are located out in an isolated setting find themselves taking on roles above what they were originally trained to do and qualified to do. Some improvements for the rural community may include the Hospital at Home project, which allows patients to remain at home while receiving treatment for things such as IV antibiotics and saline drips. This service is run 7 days a week by the Metro South Community Health and includes 1 full-time doctor and 3 nurses. Case studies have shown that patients are still able to look after small children and complete the necessary day-to-day tasks required to keep their household running while still receiving the essential treatment that they need. While the project is only run in the metropolitan areas, with the proper funding, the program could be used in the wider rural and remote communities. Funding such as the National Rural and Remote Health Infrastructure Program in 2011 allocated grants to rural healthcare workers and businesses capped at $500,000 for refurbishments, equipment upgrades and strategic service planning for rural private hospitals. In a 2-year project, grants totaling over $3.5 million were given out in 5 implementation sites to develop and put in place extended care paramedics within the local communities. Paramedics will receive extended care training and commence their new roles in January 2013. The tasks undertaken by the extended care paramedics are expected to complement the primary health care delivered by general practitioners in the community. In other words, paramedics are now going to be able to take on the roles of the local GP to ensure that everyone gets the proper follow-up care that is required. Thank you for listening to my discussion on extending training, funding, and capping distance difficulties in the rural or remote settings. It ensures all healthcare providers have the same access to clinical decision support to give the same standard for patients around the country.